Morning, my name's Eric Stevens. I'm a pulmonary critical care doctor in northern Colorado. I work at the UC Health hospitals, but I also work at the long-term acute care hospital of northern Colorado and the associated rehab hospital in northern Colorado. And I want to talk about respiratory failure and ventilator weaning. This time of year we see a lot of people with respiratory failure from things like influenza and other infections, but there are lots of reasons a person could end up on a ventilator, also known as life support or mechanical ventilation for the breathing, and those include injuries such as trauma or progression of underlying lung disease like asthma or COPD. And usually the problem is temporary and people are able to start breathing on their own and come off the ventilator without much ado or much trouble. But occasionally that's a difficult process and people end up more or less stuck on a ventilator for a longer period of time. And then we embark on this process that we call weaning, where we try everything we can to get people to breathe enough on their own that they're able to breathe without the ventilator. And that's one of the things we specialize in here at the long-term acute care hospital is people with respiratory failure who have not been able to come off the ventilator in the original hospital. And we have a number of approaches that we use to try to get people better. It's a multidisciplinary process, meaning we engage the physical therapist, the occupational therapist, the pharmacist, the nutritionist, the respiratory therapist to do everything we can to optimize a person's strength and their emotional strength and their medications and their nutrition so that they can get strong enough to breathe on their own and get on with their lives. And we have a very good program here with good success rates. And if you have any interest in it or any questions about it, I encourage you to visit the website or even to visit the facility and take a look around. Thanks for your time.